What if I told you that the keys to maintaining a healthy sexual life are not as complicated as you think? Imagine being able to improve the health of your penis in a simple way, without the need for expensive or complex treatments. In this video, I am going to show you 5 essential care practices that every man should follow to ensure his sexual health remains in optimal condition. And at the end, I will give you a 6th recommendation that very few people know about, but that can truly make a difference. If you stay until the end, you will discover how to protect your penis from conditions such as erectile dysfunction, penile cancer, and sexually transmitted diseases. Does that sound interesting? Stay with me. I am Dr. Samira Posses, a urologist, and my work focuses on both male and female health. In my practice, I treat cases related to urology, urinary dysfunction, cancer, surgery, and more. What I want you to understand today is that the health of your penis does not depend solely on your sexual practices. There are many external factors and daily habits that play a crucial role. Now, I invite you to pay close attention to these 5 care practices because if you apply them, you will be protecting your sexual well-being in the long term. Let's begin with the first care practice. Keep your penis active. Yes, you heard that right. Keeping your penis active is fundamental. We all know that the body needs exercise, but did you know that your penis also needs constant activity to function properly? This does not only mean having sexual intercourse or masturbating. In fact, men who do not have an active sex life or do not masturbate can also maintain erectile function through other techniques. One of them is the use of a vacuum penile pump or even pelvic floor physiotherapy, which helps stimulate erections. However, the best method is still maintaining an active and regular sexual life. Disuse of the penis, like any other organ in the body, can lead to loss of function, and the worst part is that this loss can be irreversible. So if you want your penis to continue functioning properly, do not neglect it. But it is not just about activity. There is another care practice that is often overlooked, yet it is extremely important: personal hygiene. I know it may sound basic, but penile hygiene is crucial to prevent serious diseases. In fact, in Brazil, penile cancer is a significant health problem, and its main cause is poor hygiene. The risk is even greater if proper cleaning is not done after sexual intercourse. The vaginal pH is different from the penile pH, and if you do not clean properly, you can disrupt the local bacterial flora. Use a neutral or glycerin-based soap, dry the area well, and prevent any accumulation of secretions. Such a simple step, when done correctly, can prevent many problems in the future. Can you imagine that something so simple could make the difference between perfect health and the development of serious diseases? Now, let's move on to another important point: sexual intercourse with a partial erection. This is one of the reasons many men are unaware of when it comes to preventing penile injuries. When the penis is not fully erect, it becomes more susceptible to small traumas that, over time, can turn into major problems. These microtraumas can lead to the formation of nodules in the penis, which later develop into what we know as Peyronie's disease. Although this is not widely discussed, it is an essential care practice. Maintaining a fully erect penis during sexual intercourse not only helps prevent these injuries, but also ensures that the sexual experience is much more pleasurable and safer for both partners involved. You might be surprised to know that many of these injuries, if ignored, can eventually require surgery, something that can clearly be avoided. But that is not all. A 4th care practice that few people talk about, but which is extremely important, is avoiding excessive pornography consumption. This may surprise you, but excessive pornography use is affecting the sexuality of many men, and not in the way you might expect. Over time, frequent pornography consumption can create a disconnection from reality. The brain becomes so accustomed to visual stimulation that it struggles to enjoy normal sexual relationships. Men who develop an addiction to masturbatory stimulation may find their ability to have satisfying sexual relationships with a partner seriously compromised. That is why, if you feel that pornography consumption is affecting your sexual life, it is time to stop and reconsider how you are managing that aspect of your life. And finally, but no less important, healthy lifestyle habits. Sexual health is not isolated from the rest of your well-being. Everything you do in your daily life has a direct impact on your sexual health. Eating well, exercising, staying properly hydrated, and avoiding alcohol and cigarettes are essential. These habits not only improve your overall quality of life, but also protect your penis. Cigarettes, for example, are one of the main causes of erectile dysfunction because they reduce blood circulation, preventing the penis from receiving the oxygen it needs to function properly. So, if you want to preserve your sexual health, you must become aware of what you consume and how you live your daily life. The connection between your body and your sexual performance is much stronger than you might imagine. Up to this point, we have discussed care practices that are fairly simple and accessible to everyone. However, there is a sixth piece of advice, one that is rarely mentioned and little discussed by professionals. This advice could be the key to preventing nighttime trauma to your penis. But I will leave that for later. Keep watching, because what comes next could completely change your perspective. Now that we have covered the most common and fundamental aspects of maintaining good sexual health, let's talk about something you probably have not considered, but that can make a big difference. The habit of sleeping without tight clothing or with looser underwear. Did you know that the way you sleep could be affecting your sexual health? Although it may sound strange, sleeping with tight underwear or bedding that compresses the body during the night can cause pressure on the penis during nocturnal erections. And this is a serious issue, because constant compression can lead to what is called local fibrosis. Do you know what that is? Fibrosis occurs when tissue hardens and becomes thicker. While it may not seem like a major issue at first, over time this fibrosis can evolve into Peyronie's disease, a condition that causes curvature of the penis, complicating not only erectile function but also causing pain during erections. That is why my recommendation is clear. Sleep without tight clothing, or if you prefer, wear looser underwear. This simple change in your nighttime routine can prevent unnecessary damage that could otherwise progress over time. Many times, small changes that seem insignificant can have a major impact on our health, and this is one of those cases. It is important to remember that your sexual health is not limited to what you do or do not do in the bedroom. The decisions you make every day, from what you eat to how you take care of yourself, directly influence the well-being of your penis and your sexual performance. If you implement these 5 essential care practices and make small but powerful changes in your life, your sexual health will improve significantly. And do not forget that final recommendation, the one that could be the secret to avoiding complications that many men face but rarely talk about. If you focus on keeping your penis active, practicing good hygiene, avoiding excessive stimulation, maintaining a healthy lifestyle, and being mindful of how you sleep, you will be protecting not only your sexual well-being, but also your quality of life in the long term. It is not just about avoiding disease, it is also about enjoying a full and satisfying sexual life. We all deserve to live with confidence, health, and without the fears that often accompany sexual dysfunctions. So if this content has been useful to you, I invite you to like this video, share it, and of course, leave your comments and questions below. I am always happy to respond and continue sharing more guidance with you.